Hello, and welcome to 5 Minutes of Interoperability. Today, we'll be speaking about an emerging standard for data access worldwide by patients and medical apps. It's called International Patient Access. So let's get started. Why do we need an international standard? As many of you already know, FHIR, or FHIR, which stands for Fast Healthcare Interoperability Resources, is already being adopted by many nations worldwide to be able to exchange and access medical data. So, if FHIR by itself is an international standard, why would we need another standard to be on top of FHIR? Well, International Patient Access is a standard that comes and puts additional constraints on FHIR, in particular in how you access and authorize that information, and also some minimal expectations around data. Why do we do this? Well, we do this to support data exchange worldwide, patient access to information, and also the ability of medical apps to be able to operate on any system using the FHIR standard. The International Patient Access Standard aims to enable regulators, empower patients, and guide app developers worldwide towards greater consistency so that multinational apps and FHIR servers can really interoperate across many different domains, countries, nations, and territories. There are two primary goals associated with the International Patient Access, or IPA standard. The first one is secure, simple, authorized access to data. IPA defines how apps are authorized to access data using RESTful FHIR APIs, or Application Programming Interfaces, and the widely deployed HL7 Smart on FHIR capability that allows you to authorize, using OAuth 2, access to that information. In addition, IPA tries to provide a familiar set of data types and profiles. The IPA specification defines a minimal data set in FHIR profiles describing an international baseline, as well as providing some example clinical content. These FHIR profiles describe the content to be globally harmonized, based upon known existing country-specific base profiles. So, what are the profiles that are defined within IPA? Well, we have the allergy and tolerance profile, representing an allergy or intolerance of a patient, the condition profile, representing a diagnosis or problem of a patient, document reference, which is the ability to reference out to either a set of narrative in textual form or even to other types of documents on a patient, immunization resources, representing vaccines that have been administered for the patient, medication request and medication statement, which are resources that describe medications to be administered or already being administered to a particular patient. The observation profile, which represents things like vital signs, lab results, and also other observations about a patient's status. And also the patient profile, where you keep their demographic information. In addition to these 8 resource profiles defined within IPA, you also have supporting profiles. That includes practitioner and practitioner role, which allows you to describe person or the clinician that's providing care to a patient and their role, as well as medication, which allows you to give additional detail behind a medication request or medication statement about the particular ingredients being administered to the patient. In addition to these supporting resources, IPA also defines some server capabilities. This includes a capability statement, as well as an operation that allows for the fetching of a document, specifically something that would return a document reference, and that's often called the $docref operation. So what are some of the values that are provided by the use of international patient access? First, we want to be able to develop apps that work worldwide, and we don't want to have a lot of customization as we go country to country. This makes it easier for app developers to be able to develop one set of code and have it deployed across many different countries, nations, and territories. In addition, we want to be able to have healthcare organizations, no matter where they are in the world, be able to absorb, to integrate, and to use these new apps that are being developed according to a common baseline standard. That's better for innovation, and it's better for changes to the delivery model to be able to improve care, quality, and also care efficiency. Finally, having some standards around data, and specifically having standards around patient access to that information, makes this data more accessible and usable by patients worldwide, particularly as we think about a world where people will be accessing data on their phones, mobile devices, and computers much more readily. You may have heard about a related standard to IPA called IPS. We're not going to go into the details of the differences between IPA and IPS. IPS stands for International Patient Summary. IPA is really that universal expectation for access, search, and for content profiles, while IPS is really a cross-border summary for care transitions. IPS profiles are generally conformant to IPA profiles, and the key thing to take away is that countries can use both of these things in conjunction to be able to support interoperability as patients want to access their data worldwide. So where is IPA around the world today? Well, many electronic health records, or EHRs, are already supporting FHIR and are already conformant to IPA. In addition, we see dozens of nations worldwide that are implementing FHIR and coming up with national specifications. Often those are referred to as base or core guides within a particular region or nation, and many of those guides are already conformant to IPA as well. Some nations are explicitly referencing IPA and building on top of that base in their national profiles. Two nations that are already doing this include Denmark and Finland. IPA has been developed as a minimal set of data expectations globally. And in doing so, it sets a baseline for how medical apps and EHRs will interact worldwide to access, authenticate, and be able to search for information, as well as what they're going to get back. So where do you go if you want to learn more? Well, in 2023, the 1.0 version of International Patient Access was published, and we'll include this link in the description below. In addition, we'll include a link on a blog post for International Patient Access, which gives more details around different implementations worldwide, as well as how the standard can be used by medical apps and electronic health records. Finally, we invite you to join us at HL7 events and also on chat.phir.org, where you can sign up for free. We encourage you to talk to your EHR vendor, people involved with setting standards within your nation, and also health system administrators and CTOs to make sure that they're adopting FHIR in a way that's compliant with IPA, because it makes everything better. Thank you so much for your time and attention.